Thank you, Morgan. Good afternoon. Bonjour, Quay. Good morning. I guess we got to start it ahead of time here. So I want to thank you all for joining us here today. I'm joined by my Atlantic colleagues who I've been happy to host over these last couple of days, not only for the Council of Atlantic Premiers meeting, but also for a very special event opening the 2023 Canada Winter Games. The 23 Winter Games has been years in the making. And I think I can say on behalf of all of us here that the hard work and the many staff and volunteers over the last 4 years have allowed us to roll out the red carpet and welcome the nation to P.E.I. and over the next 2 weeks to allow some of the most talented athletes to compete in their respective sport, to celebrate culture, to build friendships, and to make memories that will last a lifetime. Over the last couple of days, we've all been out visiting and cheering on athletes from our respective teams, and I should note, in the spirit of competition, there's a couple of big games here today, with Team P.E.I. taking on Team Nova Scotia in Ringette down in Montague later this evening, and Team P.E.I. takes on Team Newfoundland and Labrador this evening in men's hockey in Summerside, so we'll do our best to get to those events. Both are big games for both teams, and I look forward to taking in some of both. During our meeting this morning, we discussed the Canadian Health Transfer offer from the federal government that was presented to premiers recently in Ottawa. We also discussed how we can continue to innovate and modernize our healthcare system, not only in our respective provinces, but in the region as a whole, focusing on system upgrades and new approaches which will be key to achieving the access that Atlantic Canadians expect and deserve. Over the last number of months, our 4 provinces have been working on launching an Atlantic register for physicians and surgeons to improve mobility within the region and to cut down on the unnecessary red tape and administrative burden for physicians who want to work within the region in any of our healthcare systems. So starting May 1st, 2023, physicians will now be able to opt in to the Atlantic Register and will be able to work at any of the Atlantic provinces seamlessly without any additional licensing requirements. We also discussed how we can work together as a region on foreign recruitment of health professionals and find pathways for expediting licensing for healthcare professionals, for both domestic and international healthcare professionals who want to come to Atlantic Canada to work within our healthcare system. And on that, we also discussed how we can continue to work as a region on immigration. With the success of the Atlantic Immigration Pilot Program, the 4 of us see continued opportunities to extend this program for an expedited pathway for foreign healthcare workers and other areas for streamlining the immigration process. As part of our discussion today, we will be writing Federal Immigration Minister, the Honourable Sean Fraser, to invite him to join us for an Atlantic Immigration Summit to explore these new opportunities. We also discussed the challenges and opportunities we have as a region when it comes to increasing the supply of housing in this region, but also what we can do collectively to support those who are experiencing homelessness. As a group, we know that more has to be done to increase our supply of housing in the region, and we are committed to working together with our respective local municipalities to speed up new construction and create new opportunities for increasing the housing supply and increasing the vacancy rate within our respective towns, cities, and in our provinces. We discussed also the importance of regional air travel for Atlantic Canadian residents and the need to ensure access to reliable and affordable regional air routes to ensure the connectivity within the region and improve access to the rest of Canada as we participate in this small global economy. And last, at the conclusion of the meeting, we talked about the recent Bell 911 system outages that we have experienced in the last number of weeks. We raised the importance of having a resilient and robust EMS system that Atlantic Canadians can rely on. And as Atlantic Premiers, we will be writing the federal government to raise our concerns and to continue to encourage improved service. So with that, I'll turn it back to over to Morgan. We'll take some questions from our friends in the media, and once again, thank my colleagues Andrew, Tim, and Blaine for making this weekend very special.
Terry, The Guardian.
Hello. So this is a question for Premier King. It's estimated that, or it's been said that PEI is going to get about 48 to 50 million more in the federal house transfer. What specifically do you think that should that money go to? What specific area?
Yeah, so the total package for PEI is about 65 million, 49 or so is what is new money that we hadn't booked. So I think we will continue to use that money to invest in the innovation and the further innovation of our system. We continue to point to items like Pharmacy Plus, where we're having islanders access 32 common ailments that they can be treated for in pharmacists across PEI. And pharmacies, of course, are in communities large and small, urban and rural. That takes money. Whenever you continue to expand the scope of practice for individuals within the healthcare system, there's going to have to be more money to do that. But, you know, we have to continue to invest in health, human resources. We have to invest in mental health and addictions. And as most islanders and Atlantic Canadians know, there's no end for the need for continued investment in healthcare.
And just one more, with this physician mobility registry, what would you say is the gap in terms of how many doctors that this could add?
Well, it'd be hard to put a firm finger on the gap or what the challenge is, but we do know, as Prince Edward Island, for example, the 40 new doctors that we recruited in 2021, as an example, over 50% of them were locums who came here first through one of these agreements and came here, did some work here, found a comfort level here, and opted to come back. So anytime there's mobility within the system, certainly for a small jurisdiction like Prince Edward Island, and I would say within all of our Atlantic provinces, that it really increases the opportunities for physicians to work here. I think the next step in this is obviously trying to make it easier for all healthcare professionals to find their way to locations such as ours. And I think what we talked about at our meeting was essentially anything that we can be doing, working together collaboratively to sort of get rid of some of this red tape. A lot of the stuff, as we've all admitted to, some of it is self-inflicted wounds in terms of how our systems are built, but we're changing that along the way. And an agreement such as this registry right now, I think it will make nothing that we do in health is a magic bullet that will just miraculously fix everything. But I think this is just one more small little thing that keeps us moving forward and will make a difference, not just today, but into the future.
Derek, CTV.
Hi, good morning. I'm just wondering if you've spoken with each other about what you plan on asking of Ottawa on the healthcare bilateral talks.
Well, I can just start with that. I think the bilat process is really just beginning. I think Premier Furey has had an initial meeting where I think we're hosting ours this week with Minister LeBlanc and Minister Duclos to sort of get into the nuts and bolts of what that looks like. But I think through that process, I think it's really trying to make sure we have an agreed upon, focus of shared priorities for mental health and addictions, health, human resources, all of the things that were outlined in that deal. So I think certainly as a small jurisdiction and within this region, which is a small jurisdiction in our country, we have tended to do better when it comes to the bilateral process in terms of getting money more directed, but actually getting a bigger chunk of money. So that's what we're really hoping for here in this process. But I think maybe we'd start with Andrew and he could give us the most up to date.
Thanks. Certainly, the meetings that I've had with Minister LeBlanc and Minister Duclos have been very productive. It's very high level, and it's along the lines, as Premier King has described, about shared priorities and the importance of shared priorities in our own jurisdiction. But it's a pretty consistent theme and narrative across all of Canada, from coast to coast to coast. It's shared priorities in things like health recruitment and retention, mental health and addictions, data sharing and health information infrastructure. So all the things that we've been talking about as shared priorities for several months now have been largely laid out at a very high level. And we've used the next level, deployed our ministers, if you will, and officials to discuss in particular the specifics and the granular level about what those priorities look like. I think Premier King mentioned, and I think it's really important that Atlantic Canadians understand that this is a big win for Atlantic Canada in that it allowed us to move away and shift the federal government's formula from being just per capita to a non-per capita formula within the bilats, and that allows for consideration of demographics, geographic complexity, economies of scale, which are not captured in a straight per capita formulation which existed previous. So as Premier King said, it'll unlock financial power for us, fiscal power for us as premiers, but more importantly, it will unlock program funding for Atlantic Canadians so that we can deliver that modernized healthcare system largely into the future.
I mean, look, the quantum of that's available for the bilats is well known, and it's the requirement of the federal government, from my perspective, is that it be invested in healthcare in new initiatives to improve access to healthcare. So we're on the same page. We have the same priorities as the federal government, and we have there's no issue investing new money in the healthcare system. We're doing that in Nova Scotia, and we'll continue to do that. So productive discussions. Everybody wants the same thing. That's more access to healthcare for Nova Scotians, for Canadians.
Yes, thank you. I think that, that we all, as you know, we are all looking for more in terms of financing. But I think the message that we get from the federal government here is that, and we've all been saying that as well, is that it isn't about continually more money in the system is going to fix it. There always will be increased healthcare costs, and the demographic, recognition is huge for us in the Atlantic region. The idea of finding better practices to do the same thing only with better results is paramount for healthcare, because we've been funding healthcare heavily, and we still will keep funding healthcare heavily. But the transfer payments that we saw, only amount to 3 or 4% of our total budget. The total transfer payments amount to about 30%. So in our case, $3.6 billion budget, about $1 billion of that. So there's a recognition that we've all got to get better at managing taxpayer dollars in the healthcare system, and I think we can do that.
Stacy, CBC.
Hello. Right now we know there's about 14,000 people waiting for a primary physician here in Charlottetown. There are 40, you said, physicians that came in 2021. What more can you offer physicians to come here and work, because there's a huge gap?
Yeah, look, I mean, but I think the reality of it is that, Canada in general is 20,000 doctors short. So it's just the reality that it's not so much, and I know we've heard a lot about hiring practices and things like that, but the biggest challenge we face in hiring is that there's a lack of people to hire in the country. So that's why we're trying to diversify here with our patient medical homes. We're trying to change the system of delivery. The doctors that we're working to recruit and have recruited want to work within a collaborative practice such as what we do in our patient medical home. It's not just about money, but the remuneration has to be there for sure. But I think it's a collection of a number of different things that allow a physician to work within a collaborative model to get the assistance they need. The doctors who are graduating now and coming into family practice, if they're choosing family practice, they're more concerned about quality of life and all of the other, like we all are, and you have to respect that, and we have to adjust to that. But I don't think there's any one magical thing to do. I do think when they get here and they work within the system that we're building, it's a good sign that they're when they stay, and that's going to continue to be our focus. So.
How are you reaching out to potential physicians to come here? In what ways?
Yeah, well, we have a very, defined recruitment and retention team that does this. We have changed in the last number of years because you have to. So rather than just casting a net saying, hey, you're a doctor, come to P.E.I., we're trying to target a little bit more specifically, find out what the physician's interests are, what their family situation is, what motivates them each day, and then try to put a package together to be a little bit more creative than just saying, here's a 10% raise, here's a relocation fee, come to P.E.I. So we're really trying to get into the nuts and bolts to actually recruit the individual, which has been, an adjustment for us, but I think it's been successful. But I do also, I go back again to the collaborative model of practice that most physicians coming out of school now are really, really eager to work within. I think as we rebuild our system and retool it and get it ready for the next stages of the future, that all of that will help play a positive role in recruitment, but it can't be lost. And I mean, nobody knows this better than Dr. Furey, that there's not enough professionals within the system to recruit, and that's where we all struggle. So,
Thank you. And now we'll head over to the phone line. Suzanne Lapointe, Global News.
Hi, can you hear me now?
Yes?
Okay. I want to hear more about this Atlantic Registrar of Surgeons and Physicians and mobility in the region. Does that mean that they could travel for one-time services? Like, let's say there's no surgeons available for particular surgery in New Brunswick, so they'll get someone from Nova Scotia? Or is this about more freedom for them to move their practices between the provinces?
Yeah, Andrew, do you want, yeah?
It would be both, really. Right now, for example, when I fill out my college paperwork, I just get a license for Newfoundland and Labrador. So for me to come and work in P.E.I. or New Brunswick or Nova Scotia is quite onerous. And it's also, it can be a significant barrier and a significant deterrent for a practicing physician to either take a locum piece of work or to split their practice, if you will. So what this will do is allow physicians in each province to, as they're filling out their annual college renewal, to opt into an Atlantic licensure. So people who would like to move around in the summertime, for example, P.E.I. is a beautiful place and want to come and spend a couple of weeks with their family, they could certainly do that. Equally, as someone who's now trying to secure medical services from the province's perspective, it will open up the pool of people who are available for certain gaps in the system, as you suggest. For example, there's not an emergency room physician available for Norris Point. Well, right now in Newfoundland and Labrador, we'd be limited to the Newfoundland and Labrador College, but it could open up to the rest of the Atlantic region. And we think that, especially with new physicians, there is a want and desire to have a different style of practice, one that offers opportunity, geographic opportunities, different experiences, that having this mobility and eliminating the barriers to moving around Atlantic Canada first, and ultimately we hope the nation, will be something that's very attractive. It's certainly not something that's going to fix the problem, but it gives us more Band-Aids, if you will, to help plug some immediate issues along the way while we are developing a moderate and modern system for the future.
Couldn't this have a negative effect in that it hits the Atlantic provinces against each other? So, for example, if one of the Atlantic provinces pays more than another, then if the physicians don't have those barriers in place, they could just easily move to the highest bidder.
Those barriers aren't in place now. If a physician wants to move to another province, they can. What we're talking about is making it easier for them to kind of pitch in where it's necessary in other provinces. But the reality is that they can get a license in as many provinces as they want. It's just an onerous, complicated process that they wouldn't follow to do a locum in one province for a couple weeks in the summer. But this will make it easier for that mobility, and it's the first step in a bigger discussion that has to happen. But look, if a doctor wants to go through the process that exists today and move to another province, they can. They'd be more motivated to do that for a real permanent relocation. What we're talking about is, temporary pitching in, mobilizing the resources of the region to help where it's really needed and making it efficient in a way that we can do that.
And beyond that, professionally, it's just the right thing to do. I mean, right now, we trust in Newfoundland and Labrador, we send our transplant patients to Toronto, for example. We send some patients to Nova Scotia for specialized care, but it's an onerous process for that surgeon or provider to come to Newfoundland and Labrador. That just doesn't make any sense. Professionally, it doesn't make sense. Canada is a small country from a population perspective. We all have great medical training, great credentialing. We should be open and mobile to go across jurisdictions and to be able to have that creative style of practice that just hasn't existed today. So from the Atlantic region, I very much don't see this as a competitive space. I see it as a collaborative space, and when one wins, we all win.
Michael McDonald, Canadian Press.
Yes, thank you. Last week, as you all know, the Public Order Emergencies Commission issued its report on the Freedom Convoys, and it found that the federal government had met a very high bar for invoking the Emergencies Act. You've had a bit of time to think about this. There are implications for the provinces. I'm wondering if any of the premiers want to weigh in about how they feel about that report and how it was handled by Ottawa.
I guess I can start. I quite honestly haven't read too in-depthly the report as of yet. Was briefed very informally as to its contents, but in watching the news coverage, it's obvious that the the federal government met that criteria, but I do think this is something that is designed to be used sparingly, if at all, for only very, very significant and serious reasons. It wasn't something that impacted Prince Edward Island, and I made that known when we were on the call with the Prime Minister when he had talked about invoking the Emergencies Act. But, you know, I think there's always lessons to learn from all of these experiences that we're living through, and I think that, you know, the bar should be high to when you're setting it to invoke the Emergencies Act, and I think we'll learn a lot from this.
Anyone else want to answer that?
I think you got your answer. No, I'm satisfied certainly that the procedures were, you know, I'm satisfied certainly that the report was done. I think it's important. It's mandated, of course, but certainly it's all-encompassing. It was comprehensive, and I think it should give Canadians some assurance that the threshold was met. It's certainly not something I'm sure that any leader wants to invoke ever, and I'm sure that there are lessons learned to be improved if God forbid it ever has to be used again. But certainly the review was robust. I mean, we all saw the Prime Minister take the stand on national TV. It was a robust review, and one that the conclusions, I think, are solid, and Canadians can take comfort in, but also future leaders can learn from.
There's just one other question. Last week, a Liberal MP from Montreal suggested it's time for the country to debate the use of the notwithstanding clause. The MP is asking whether the provinces have a right to use that clause preemptively. Anyone want to take a stab at that?
Notwithstanding no
Not
one
all at
answering,
once.
I
Not
think,
all at once here,
yeah. But certainly it's constitutionally protected, and it's one that I think provinces should use sparingly, if at all. You know, I'm not going to weigh into what the federal debate is on it, but it is something that is rightfully and prescriptively assigned. Should it be required to the provinces, and it's not one that we look at using preemptively, but I'm not going to comment on what other provinces do because it is rightfully and responsibly their jurisdiction.
Richard Duggan, VOCM News.
You're on mute there, Ricky.
Hi there. Question for Premier Furey about the Atlantic Registry for Physicians. Wondering if you've had conversations with stakeholders in this province about this, such as the College of Physicians and Surgeons, and what do they think of it?
We have indeed. In fact, all of us have. We've involved our colleges from the inception of this, and then it's advanced. I think, you know, COVID has helped advance this conversation quite significantly, and the colleges are on board and supportive. And I can tell you, as a provider myself, and having family members and friends and colleagues who are providers, this is something that is much welcomed.
And it was mentioned that regional air travel was discussed at your meetings. I spoke with Hospitality NL last week, who said that air access is their biggest concern in Newfoundland and Labrador. Could you tell me a bit about what was discussed in that regard, and how will you be working towards increasing air access in Newfoundland and Labrador?
Sure. It's a shared concern. It's not unique to Newfoundland and Labrador. It's shared across all the Atlantic region. As we're coming out of COVID-19 and the pandemic, the travel industry, the tourism industry, the air industry has been completely disrupted. And what it looks like now is not what it looked like before the pandemic. And we want to ensure as an Atlantic region that we have those routes, that availability to businesses, to travelers, to tourists, reestablished to the same levels it was before the pandemic. We do notice, and paying, not to speak for everyone, but we're certainly paying attention to the national carriers and how they're changing their scope, if you will, and certainly as it impacts this region. And we're looking at creative ways to work together to ensure this region is protected with respect to air travel, and whether that's discussing from a more aggressive stance, if you will, or perhaps a more incentivized stance some of the more local carriers to see what their capacity is to expand or be creative within the region and connecting the region to major markets. I think that's something that we'd be willing to discuss together, or certainly something I'm willing to discuss as Premier of Newfoundland and Labrador with those individual providers. I know Minister Crocker has had great discussions with international providers and regional providers as well, and it's a struggle. It's a struggle for with respect to human resources within that industry. It's a struggle with respect to the supply chain management within that industry and security of aircrafts even. So it's something that we'd love to continue to work together. I know Premier Houston has done a heavy lift, and Nova Scotia has done a heavy lift in ensuring that the region is protected from a national carrier perspective, but we want to make sure that it's extending beyond to all the provinces. The tourism industry is so important in P.E.I. It's so important in Newfoundland and Labrador that we want to make sure that we have people want to come. We want to give them a way to come, and we'll look at every opportunity to create that.
Catherine Moraz, Radio Canada. Catherine, Radio Canada.
Hi, can you hear me? Yes. Oh, hi. Sorry, I was having technical issues. So my question is for all premiers. As we know, Quebec is faced with an increase of irregular migration. So Premier François Legault has officially requested to Justin Trudeau that irregular migrants be sent to other provinces in order to alleviate pressure on provincial services. So I would like to know how the Atlantic provinces react to this request.
Well, I can start, I guess, as chair of the Council of Atlantic Premiers. I had a conversation, I think most of my colleagues did, with the Federal Minister of Immigration, Sean Fraser. He had called and wanted to find out what P.E.I.'s capacity or ability to provide a location for some asylum seekers to take some of the pressure off the Premier of Quebec. So, I told him that as a full and equal partner in the Federation of Canada, we would like to try our very best to do our part. We do have significant challenges that we're dealing with right now in terms of housing availability. Wanted to have a deeper conversation about what that would look like and what our ability to help would be. But I think all of us would, I think as a part of our DNA as Canadians is to try to be as welcoming as we possibly can to those from around the world who come from difficult circumstances. But that's the only conversation that I've had, and I think it's pretty similar across the table here so far.
Yeah, I guess if I just add to that, I think we've been told that in the case of New Brunswick, about 150 or 200, individuals could be seeking asylum in our province, and I think it's a national obligation, and we'll all do our part, the same as was done a few years back with Syrians. So it's we don't know the details any more than that. We know it'll add to the housing situation we all have, but it's the right thing to do.
That's good. Yeah.
Thank you. That's it for me.
Teresa Wright, Global News.
Hi there. This question is mainly for Premier Higgs, but if other premiers could also weigh in, that would be great. All of your finances are benefiting from higher than expected revenues over this fiscal year and last fiscal year. Wondering why you're not using more of those revenues for healthcare, even as you and the other premiers have been demanding more money from the federal government.
So if I started off with that, the situation we have with healthcare and identifying where we can make improvements, we've been putting record amounts in healthcare for a long time. I think last year it was 8 or 10%. This year it'll be similarly in the same range, 8 or 10%. But the fact is, you every time that we talk about it, it's saying, okay, I'll put money anywhere I possibly can that patients will see better results. So if we can do more surgeries, we'll certainly do that, and we'll utilize our facilities all across the province, and we'll do weekend surgeries, which is what we're doing right now in one area. We did the cataract surgeries in the north as a pilot. We've reduced the wait time for cataract surgeries by 70%, and we will continue to put money anywhere that it'll reduce, the backlog, the waiting times. And we can make better use of the resources we have. So I know it's always a headline to say I've put another $5 million in healthcare or whatever, but if it doesn't have any results tied to it, it doesn't really mean much. And I guess if I used a little stat just as a conversation, so we have about 55,000 now on the wait list, and that's down from 75,000. But if every doctor in our province took 2 or 3 more patients a week, we wouldn't have a backlog. So when you think about that in context of the potential, it's like, well, we would pay, they'd all have patients, so we'd pay for that patient service by the doctor, but every one of us has to find out a way that we can deliver healthcare differently. Because I think unanimously, we'll all say, just putting more money into an unmanaged system isn't going to fix it. But I think we're all in a position to be innovative in this process. And when I mentioned about the health transfers earlier, about what we each received, much, much less than we planned, I think that message is coming from the federal government as well, is that, you guys got to figure out better ways to deliver health care, because the continual idea of, I just need more to do better, we're not going to have more. We can't get more resources physically, and we don't necessarily have more resources, in personnel capabilities. So, but I know we can deliver better health care, and we can do it by looking at the system as a whole in New Brunswick and delivering services to anywhere in the province, but getting the best result for patient, a patient-focused delivery of services.
Yeah, I just pick, hi Teresa, I'd pick up on from Blaine and just say that, in PEI, we will spend probably $1 billion on healthcare, which is getting close to about half of our provincial budget. But I've also been consistent from the very beginning on this very challenging file, in that this isn't just about money. Money is needed, and as we innovate and change the system, it's going to take some money. But, as I said in the news conference following the meeting with the Prime Minister in Ottawa, is that I don't want anyone to leave this meeting and think that there's a bunch of money on the table and now everything in healthcare is fixed. And so I think we've demonstrated over 4 years that we'll put whatever money we need and can to put into improving the healthcare system. The money coming from the federal government will be on top of that, and it will be important and it will be needed. But the innovations and tweaks and things that we have to continue to make within the system are just as important as the money. But I think our budget will increase this year 11 or 12% in health alone, and that's a pretty significant investment at a time when it's needed. So.
Also, concerns have been raised about some of this money perhaps going to a for-profit healthcare services and clinics. I'm just wondering if Ottawa has indicated whether there will be any limits on the use of this money for private healthcare delivery, and will any of you are you planning to use this money for for-profit healthcare services or clinics?
I think that there's a definition here to be had about what's private healthcare and what's not. So if I use the cataract surgeries as an example, so this is the case of a doctor who would have been doing this very same thing in a facility owned by either Horizon or Vitality in our case. And the only nuance here is now this procedure is being done in his clinic in Bathurst, but it's still paid fully by public healthcare system. We had in our requirements, our Health Act in the province, we basically had a stipulation there that you could only do certain things if you were doing it in a facility owned by the government. Well, now, how does that make a difference in healthcare? So what we said is, well, it doesn't matter where it's being done, as long as it's being done to the right standards, and if it can be done more convenient to patients and they can get better results out of it, then it's a publicly funded system done in a doctor's office as opposed to in a hospital. And that has worked very well in that, and I think there'll be more of that. But I don't see, we shouldn't confuse it with private care. It's publicly funded care in a different location.
Frederic Camarano, Radio Canada.
Yes, so I was wondering concerning, we have talked a lot about travel nurses these past few years. So this new Atlantic registry, is this a first step towards travel doctors?
Travel all the time anyway. This is getting rid of the paperwork within the Atlantic region, so to speak. I could do a locum in Alberta tomorrow, or it'd take me a month to do the paperwork. We were trying to get rid of the paperwork element. So Canadian physicians are mobile. It's just that there's barriers between jurisdictions with respect to the colleges. Right now you have 10 siloed or 13 siloed colleges. Where we've come up amongst ourselves as Atlantic premiers to have an agreement that, look, a doc's a doc's a doc, and we're quite comfortable that the training is the same, the credentialing is the same, and physicians can opt in. So physicians travel all the time. I mean, we're lucky in our province to have many expats across the country who come back to the shores of Newfoundland and Labrador to locum in the summertime. And I know that's the same in Prince Edward Island as well, and I'm sure throughout the rest of Atlantic Canada. And this just makes it easier for those who are living in Atlantic Canada to do that.
And Premier Higgs, so New Brunswick will get more than $1 billion in new healthcare funding from Ottawa. How do you intend to spend this money, and will there be any Atlantic initiatives with this money?
Yes, I think, certainly the idea and the concept is, can we do something better? And when I mentioned about the surgeries, and can we increase those surgery levels and doing them in a concentrated format, we'll look at our backlog. I mean, the shared priorities are pretty consistent. We haven't had our meetings yet with the two ministers, but I'm confident that we won't have any real disagreement at all on what our priorities for the province. And the money will be definitely used to where we can see an improved result. That's what the federal government are asking for. And certainly that's what we need to see, is that the patients can feel the difference. And so we will be using that allotment to do just that.
Kate McKenna, CBC.
Good morning, Premiers. On the topic of the physician register, I'm just wondering if there have been any discussions in terms of possible challenges in terms of continued care, like continuing one person's treatment throughout the healthcare system if people fly in and out for short windows of time.
Well, again, this model already exists. Locum doctors, for those that don't know, are doctors that aren't practicing permanently in a position, but they'll come in and fill in for vacation or gaps in the scheduling system. So this already exists. We're just making it easier on the docs themselves so that they don't have to be burdened with excessive barriers of paperwork. So this model already exists. It exists in every province, and we're quite fortunate to have it because it does fill in gaps. But what generally happens if someone comes in, for example, to fill in for a family doctor, they will have a handoff from the family doctor they're filling in for, and then hand off after. And of course, we're all modernizing our healthcare system to ensure that we're using electronic medical records, and that record will live with the patient and not necessarily with the provider.
Thank you. My Radio Canada colleague asked about Premier Legault's letter to the Prime Minister about asylum seekers at Roxham Road. And I'm just wondering if I can ask Premier Furey and Premier Houston the same question. Have you been approached by the federal government to take on asylum seekers, and are you willing to do that?
Yeah, yes, we have, and Newfoundland and Labrador does bat above its weight and per capita to look after and welcome refugees from all across the world, whether that's Syrians or Afghanis, and we were certainly willing to have that discussion with our federal colleagues. It is heart-wrenching to see those pictures, to see the images, to hear the stories, and as I'd echo the comments of the other premiers. This is a national issue, and every province has to play a part, needs to play a part. It's the responsible thing to do. It's the right thing to do. But it also has to come with some support from the federal government to ensure that these people are actually not just being moved, but are being moved and looked after. And that's where Newfoundland and Labrador wants to be and needs to be.
Same situation for Nova Scotia. Yes, we've been asked, and yes, we'll do what we can for sure.
Nadia Goudreau, Radio Canada.
Yes, hi, can you hear me?
Yes.
Yes, my question is more for Premier Higgs. Mr. Higgs, you firmly believe that modifying the way the young Anglophones learn French was paramount to a real bilingual New Brunswick. And I was wondering, how do you feel about the changes that were announced Friday by Minister Hogan?
Well, obviously, if we continue with a two-tiered education system, we're not going to get any better results than we have seen in the last 50 years. We have less than 30% of our English students graduating as bilingual, and if you move that down a few years down the road, there'd be a fraction that was actually still practicing both official languages. So my point has always been we can do better than that. We're a bilingual province, and if we really truly have that as our ambition, which I do, then we need to look at our education system first. The education system has a very severe streaming where we see kids being separated and moved into one element of the classroom and another or school and another in another portion of the school. We see very much behavioral issues and many of the teachers, you know, in the English system have great ideas. Unfortunately, in these sessions, rather than kind of get to the root cause of how do we fix this, which the Commissioner wrote the report on, it becomes a shouting session and it becomes distracted in terms of what is the real point. So while I respect Minister Hogan had to make a change given where we were, but what I'm hopeful is that the conversation has only just begun. And I'm hopeful that the NBTA will play a key role here as we move forward in finding a case where parents don't have to make a decision when they're putting their young one in kindergarten or grade 1, but we have a system that's fair and equitable for all of our students. And right today we don't. We have a class system that is not fair and equitable. And I'm one who had put all of my kids in French immersion. But that's not the best end result in terms of having a functional society. I think one of the confusing, and I'll mention this, issues is that the goal was everyone would speak a conversational French or conversational English, but be able to converse in either official languages anywhere in the province. Unless we get the critical mass to do that, we will never really succeed. And so the point is, can we have that opportunity where choices don't need to be made at the beginning? But if you want to be a linguistic major in your senior years in school, you can branch off into that. So you come out as proficient in both languages as you want to be. But one of the fundamentals becomes your ability to speak in both languages. If we're a bilingual province, we should live up to that. So the conversation has really just begun, and I wanted to see that happen, obviously next year as an election year. But this year, we want to have that conversation, and so it's not over. It's just the beginning of fixing our Anglophone system.
That is all the time we have for questions today. Thank you very much.
Thank you very much. Thank you.
Thank you.